Welcome my dear students. Today we are going to learn about chronic obstructive pulmonary disease or COPD, a long-term lung disease that makes breathing difficult. It usually results from smoking or prolonged exposure to irritants like dust and pollution. COPD mainly includes chronic bronchitis, that is airway inflammation with mucus, and emphysema, that is damage to air sacs. Patients often suffer from cough, breathlessness, wheezing, and frequent chest infections. While COPD cannot be fully cured, early treatment, lifestyle changes, and proper management can greatly improve quality of life. Chronic obstructive pulmonary disease or COPD made simple. COPD is a long-term progressive but preventable and treatable lung disease. It means the airways are narrowed and inflamed and the airflow is persistently limited, that is not fully reversible, unlike asthma. What is the main culprit? Long-term exposure to irritants, especially cigarette smoke, but also dust, fumes, and indoor or outdoor pollution. The two phases of COPD, there are two basic phases: chronic bronchitis or blue blotter, long-lasting cough with thick mucus at least 3 months per year for 2 years, caused by hypertrophy and overactivity of mucous glands. Emphysema, pink puffer, alveoli or air sacs destroyed and enlarged, reducing the surface area for oxygen exchange, leads to breathlessness and air trapping. Risk factors, think of them as environment plus host factors. Environmental are smoking, which is the most important, passive smoking, workplace exposure like dust, fumes and chemicals, indoor air pollution, biomass fuel, poor ventilation, etc., outdoor air pollution, host related genetic predisposition, asthma like airway hyperresponsiveness, poor lung development or childhood respiratory infection. Pathophysiology, or what happens inside the lung: chronic exposure, inflammation with neutrophils, macrophages, CD8 plus T cells, changes in structure and function, chronic bronchitis, mucus gland overgrow, thick sputum cough, emphysema, alveolar wall destruction, less surface area, poor oxygen diffusion. Small airway disease like bronchioles become narrow and fibrotic. Airflow limitation, loss of lung elastic recoil, plus airway collapse on exhalation, air trapping and hyperinflated lungs. Gas exchange problem, low oxygen or hypoxemia and high carbon dioxide, that is hypercapnia. Management: non-pharmacological or cornerstone care, stop smoking, the single best treatment, avoid air pollutants in home or workplace or outside, vaccines, influenza and pneumococcal which prevent lung infection, pulmonary rehab, exercise, nutrition and breathing techniques, oxygen therapy for patients with severe hypoxemia, medications like bronchodilators, short acting like Sama, which gives quick relief, long acting like LABA, which is used for maintenance purpose, inhaled corticosteroids or ICS for frequent exacerbation, and high eosinophils, phosphodiesterase 4 inhibitor, that is roflumilast, reduces exacerbation in chronic bronchitis, antibiotics and systemic steroids, short courses during acute flare-ups, surgical or advanced lung volume reduction surgery, which is selected emphysema, and lung transplant in end stage disease. In short, COPD can be called as the long term damage from smoke and pollutants which causes inflamed airways, destroyed alveoli, trapped air, poor gas exchange and breathlessness. But with small cessation, medications, rehab and supportive care, life quality can be improved and progression slowed. In today's class, we learned that chronic obstructive pulmonary disease or COPD is a progressive lung disorder that makes breathing difficult due to long-term airway inflammation and damage, mainly caused by smoking with air pollution and occupational exposure. The key symptoms include chronic cough, breathlessness and wheezing, and frequent chest infections. The good news is, with smoke cessation, breathing exercises, proper medications and modern therapies, patients can live longer and healthier lives. Remember, avoid smoking, protect yourself from pollutants, follow medical advice and stay active. Take care of your lungs and stay healthy and keep learning. See you in the next class. Thank you.